Well, again, thank you to everyone that's joined us today for the AgrAbility webinar series. Our topic today is on occupational therapy and its role in agriculture and in rural communities. Our presenter today is Danielle Klingen, and she is a doctoral student in the Occupational Therapy Department at the University of Indianapolis and also an intern with us here at the National AgrAbility Project. My name is Paul Jones. For those who don't know me, I am the manager of the National AgrAbility Project. And before we get started with our presentation, I'm going to give a few introductory instructions. You should be able to access the audio either through your phone or the computer, and you can check out any problems or issues with your sound through the Communicate menu up at the top left of your screen. If you need closed captioning, that is available through the media viewer, and that is on the bottom right panel. You should be able to expand that or contract it, depending on whether you need the captions or not. You may have to enter a little bit of login information, but you should be able to see those and also adjust the captioning size and other things. You can expand or contract any of those choices on your right column just by clicking on the arrow next to it on the left, and you can also expand or contract the entire column by clicking and dragging on the border between the column and the presentation window. If you have questions that you'd like to ask our presenter, you have a couple of options. First, you can enter your questions into the chat option on the right. You simply expand that, enter your question, and we ask that you would send that to all panelists as your option for sending that so that we make sure that we see those questions. Also, after our presentation is over, we'll have a question and answer period. If you'd like to ask a question verbally, just click on the raise hand icon that you should see near your name, and then we will try to activate your phone or your web microphone, and you can ask your question verbally. We also appreciate it if you would tell us if there's more than one person viewing the webinar from your computer. That just helps us to maintain accurate attendance records. After the presentation and before the question and answer time, we will have 4 quick poll questions to get your feedback. We are recording the session, and that will be archived on the agrability.org website under the online training link. If you have any problems in terms of technical issues during the presentation, you can use the chat window to let us know, or if you're unable to do that for some reason, you can email me, jonesp@purdue.edu. That's the same email from which you got your instructions, so you can simply reply to that if you need to do that. For those who do not know much about AgrAbility, we are a program that's sponsored by the U.S. Department of Agriculture, and we focus on issues of disability in agriculture. Every AgrAbility project is a partnership between at least one land-grant university and at least one nonprofit disability services organization. Right now, there are 20 AgrAbility projects that are funded around the country, and there's also one national AgrAbility project that's led by Purdue University's Breaking New Ground Resource Center. And our partners on that grant include Goodwill of the Finger Lakes, APRIL, which is the Association of Programs for Rural Independent Living, Colorado State University, and Washington State University. If you'd like more information about AgrAbility, if you want to find out if you have a project in your state, if you want to view some of the more than 60 webinars that we've done in the past, feel free to check out agrability.org. There are a wealth of resources there that you should find interesting and informative. At this point, I'm going to turn things over to our presenter, Danielle Klingen, and she will give the main body of the presentation. After that, I will return with the poll questions, and then we'll go to our question and answer period.
All right. Can everyone hear me? Okay. Well, thank you for joining us this afternoon. Like Paul said, my name is Danielle Klingen. I'm a doctoral student with the University of Indianapolis, and I've been spending the last 4 months with the National AgrAbility Project working on efforts to educate occupational therapy students and occupational therapists on the role that they can play within agriculture or rural communities. So I wanted to share a little bit of what I've been doing while I've been here, as well as just give some information to those AgrAbility staff members or occupational therapists on how the partnership can be built between both professions. So the way that the presentation is set up today is that the first part will give an overview of agriculture and what that looks like. It will transition into occupational therapy and the role of occupational therapists, and then bringing it all together with a partnership and how occupational therapists can work with those service providers or AgrAbility staff members working with farmers or ranchers. All right, so we'll start out with some basic agricultural statistics for those who might not be familiar with agriculture and farmers' occupations. So when looking at some of the statistics, about 21.4 million, or 11% of U.S. agriculture or U.S. workforce is associated with some type of agricultural work or related occupation, and that could be full or part-time work. Breaking it down a little bit further, in 2016, about 730.8 thousand individuals reported that they were farm workers. Just another tidbit of information, the U.S. has been ranked as one of the top leaders in agricultural product export at about 129.7 billion, and that was according to 2016 statistics. Something interesting that I think everyone should keep in mind is that as a result, or transitioning from 2007 to 2016, the average farm size has risen. And the important part of that is that you need to consider now that farmers and ranchers might be spending a lot more time out in fields with livestock. This can lead to some secondary conditions or just some acute injuries as well. So something important to keep in mind when working with farmers and ranchers. And the last thing on this slide is just a study that was done in 2008, just explaining the prevalence of disabilities within the agricultural population. And it was estimated that about 1.04 to 2.23 million individuals were working in some type of agricultural occupation with a disability. This is a quick overview of what risk factors might be associated with agricultural work. So many of these are things that are common sense ideas that you could kind of come up with just thinking about agriculture and farming. But something I wanted to point out was this excessive vibration and motion, especially with planting and harvesting season and farmers spending a lot more time in the equipment. And this excessive vibration and motion can lead to additional acute injuries and or secondary conditions. You also want to consider the overexertion that farmers might be putting in, any increased fatigue levels. You might also have some concerns over strength and balance or limited mobility, which can all be a risk factor for or lead farmers to susceptible injuries. Displayed are some common injuries and conditions that you might see associated with farm work. So this can range from your chronic conditions such as arthritis to more acute injuries such as traumatic brain injuries, spinal cord injuries, maybe amputations as well. So all things that are all disabilities that the National AgrAbility Project or the state AgrAbility projects are working with, as well as what occupational therapists will work with as well in practice. The next few slides just demonstrate the prevalence of injuries or conditions and kind of how these injuries are happening, where they're happening for farmers, and just to give a good idea of maybe how we can prevent some future injuries. So this first slide talks about the injury source. So we're going to specifically look at the statistics from 2014. And when looking at those statistics, you'll see that the highest injury source is due to persons, plants, animals, or some sort of minerals. And then that's followed by other types of sources, and that could be chemicals, that could be parts or minerals, or just these unknown sources. Transitioning, when looking specifically at where the injuries are occurring to farmers or ranchers, the top statistic from 2014 is it's a result of injuries to the shoulder, chest, back, abdomen, or pelvic region. And then that's followed by other body parts. So this could be internal injuries, or it was just unknown of where the injury might have occurred. And this last chart just shows the nature of the injury. So how is the injury presented? And the top one for this is this category of other injuries. So this is kind of an all-encompassing category in terms of looking at scrapes or dislocations, maybe some ruptures, nerve injuries, or traumatic brain injuries. And then that's followed by our common strains, sprains, torn ligaments, and then cuts. One thing I really wanted to point out, especially for those who might not be familiar with agricultural or farmers or ranchers kind of work, is this cultural philosophy. This is one thing that I make sure to tell all of my students when giving presentations. It's a different kind of thought process that farmers and ranchers go through. So you have to think about it in the sense that farming is it's more than a job. It's someone's way of life. It's their identity. This is how they support themselves and their family. And it's not really something that you can tell a farmer that they need to give up on. So if a farmer, it occurs an injury or a disability, instead of telling them that they can't return to the farm, rather we'd work to see how we can modify the environment or modify the task to work with the farmer so that way they can return to the farm. And so farming is kind of like the quote said, it's in one's blood. And a lot of health professionals have also stated that we have to use this therapeutic use of self to understand our clients and this population and how we can get them back to where they need to go. So now we'll transition into the role of occupational therapy. So for those who might not be as familiar with occupational therapy, these individuals are helping all types of normal society. So those from birth all the way up to productive aging. And we're really looking at how an individual is able to perform their daily activities, how are they able to perform what they need to do or what they want to do. All at the same time, we want to promote function in one's own environment. So we do this by looking at the physical, the psychological, and the cognitive aspects, and how that might impede engagement or participation in one's daily occupations. So we're looking to find ways to reduce a disability, an illness, or an injury that might be impacting one's daily functioning. The next few slides will just give an overview of where occupational therapists are and kind of the role and diversity of the profession. So in the left-hand column, you'll see just an overview of where occupational therapists are practicing. So we're doing direct client services, working in administrative roles, working as consults, working in research, or just other areas. And now the consultation role might be the most relation between agriculture and occupational therapists. The right-hand column then gives more specific practice areas. These are where occupational therapists usually identify as their specialty area. So either working with children and youth, maybe it's mental health, productive aging. Work in industry is typically what would be associated with agricultural and farmer and ranchers occupations. The next slide just gives, again, a little bit more information on the practice settings that you'll see in occupational therapists. So you'll see on this slide that it ranges. We might be in classrooms working with students. We might be an outpatient. We might be going to the home. So all sorts of areas that occupational therapists are working in and that you can incorporate into agricultural work. When working with an occupational therapist, this is kind of the overarching services that you will receive from a therapist. So every occupational therapist will start out with some type of screening or evaluation, and this just depends on what setting and what age of the client. From that evaluation, they will use that to make an intervention or a treatment plan. So what is it that the client needs, or what is it that the client is having difficulty with? And then practicing and promoting function within that task. Once the therapist feels that the client is ready for discharge, they'll perform another evaluation or some type of screening just to see where the patient is at, and then that will help make some of these discharge plans. So discharge planning might be recommendations to another rehab facility, or might be to return home to the farm. These are more specifics in terms of what occupational therapists are. I think sometimes it's hard to envision what an occupational therapist does, and we typically get thrown into physical therapy. And so just wanted to highlight the diversity in the profession and what we can do. So again, we do work with children, maybe doing handwriting, maybe working mental health. A big push right now is the substance use and coping strategies, maybe working with some social skills. And then also working out in the community. So maybe we're working in the home, doing home modifications or home evaluations, or working out in the community to make some modifications as well. And the community setting might be the biggest relationship between occupational therapy services and AgrAbility projects or agricultural service providers. Again, these are injuries and disabilities that are commonly treated by occupational therapists. Everything that you saw on the previous slide with the agriculture is everything that you would see in occupational therapy as well. But I went ahead and added a few of the common conditions for working with pediatrics. And so some of those are just developmental delays or Down syndrome or Rett syndrome. But basically anything that you can think of that might be limiting to one's daily performance, we are willing to work with those patients to get them back working and doing what they need to do on a daily basis. So here's where I wanted to spend the bulk of our time today, which is talking about how can occupational therapists and AgrAbility or agricultural service providers work together and make a partnership. So through my research, I've seen that there's this bridge or this gap in care between health professionals and farmers or ranchers. So what I've been really focusing on is how can we work together as a team to reduce some of this gap in care. So this slide just kind of gives a very general overview of how we might be able to work together in terms of the services that occupational therapists are providing that might also correlate to agriculture or AgrAbility projects. So as occupational therapists, clinically, we will see farmers or ranchers for acute injuries, chronic conditions, maybe functional mobility, maybe some mental health. And so we want to be able to bring all of this together. And so take what AgrAbility is already doing in terms of assistive technology and bring that with an occupational therapist perspective as well. So occupational therapists might also incorporate some energy conservation techniques. How can we eliminate some of the hazards in one's environment to promote safety? How can we modify work tools? And we also want to consider lighting, especially for those with visual impairments. As an occupational therapist, we might also incorporate some agricultural principles into the clinic. So this might be replacing our stereotypical pegboard with maybe nuts and bolts and using hand tools to perform the same functional task. We might also want to think about bringing gardening or planting into the clinic. So how can we maybe work with the dirt and make seeds and kind of grow that? And that could also just be a therapeutic garden as well, just depending on what location and what the clinic is set up for. These next few slides are just some quick overviews of some assistive technology resources that are available. So the National AgrAbility Project has an assistive technology toolbox with all sorts of tools and equipment that could be used specifically for farmers and ranchers, but also for individuals who do some gardening, work in horticulture, those who hunt or fish. There's all sorts of tools, and this is updated constantly. So it could be used specifically for a client who might be a farmer or rancher, or could also be just a good resource if you're kind of stuck and don't know where to go in terms of helping a client. This is just a very small list of the assistive technology resources that are available, but I wanted to give those to you so you had a good idea of places that you could go if you got stuck. So on this slide, I have highlighted this resource by the National AgrAbility Project. And now this is an evaluation manual or tool that you could use when looking at assistive technology and implementing assistive technology with clients. I think this is an especially great resource for students or for those who might be new to assistive technology. So you can use this as a resource to go through and consider different areas of the tool that you might be recommending to a client to make sure that it's safe, it's feasible, and it's not going to cause any additional harm or injuries to the individual. This next resource is a great resource in terms of how can we take everyday items that we have just laying around and make those into assistive technology for our patients or our clients. So this might be something as simple as making like a cup holder for a farmer or for a client, or it could be implementing a tablet holder to help an individual be able to use the technology or a tablet a little bit easier. So this resource has all sorts of different examples, and Therese highlights many different assistive technologies in this resource. So in terms of partnership, there's partnership opportunities everywhere, and it's going to vary depending on what region of the country or what state you're in as to what opportunities might be available. So I think one thing is if you're an interested occupational therapist and want to get involved with agriculture, it might be a great start to contact your state AgrAbility project and see what kind of opportunities are available. They might be working on some efforts to promote healthcare services or to educate health professionals, might be working on projects that are helping farmers. So all sorts of things that you could contact the state AgrAbility projects about and see maybe what they're doing. Also, don't forget about local extension services or FFA chapters, even master gardener programs or therapeutic writing centers. Those might also be ways to get involved and bridge this gap between farmers and agriculture and health professionals. Let's see. So the next slide, we're going to spend a little bit of time on this one. I just want to give everyone a good idea of some examples in terms of educational opportunities or outreach efforts and these partnerships that we could do. So as occupational therapists, we might be working with an AgrAbility project to work on a numerous amount of things. So occupational therapists could be working on-site farm assessments, could be doing community assessments, maybe we're partnering to do some publications and resource material for clients, working again on this idea of assistive technology. Maybe we're promoting some ergonomics and body mechanics in the form of educational presentations, or working with students in academics or within their educational curriculums to promote this connection between agriculture. Or occupational therapists might also be doing something with universal design. In terms of occupational therapy's role within the farms, and a therapist might go out to a farm with an AgrAbility staff member and really perform these on-site farm assessments coming from very similar but slightly different perspectives. So an occupational therapist might not have the complete agricultural idea of how this occupation is performed, but working together, you can look at it from the farmer and rancher's point of view to see how their environment could be modified, maybe what tasks need to be performed but are limited based on an injury or a disability, maybe how that's impacting their daily functioning. So together, you might be asking some of the same questions in terms of, is the tractor seat adjusted correctly? Are barn doors easy to open and close? What's the lighting look like? And maybe how is the task of feeding performed? So we might be collaborating together on some of those ideas. You might also look at getting students involved. I know I don't have this on the slide, but that might be one area as AgrAbility staff or occupational therapists working in academics. Maybe we could make a partnership to have more student involvement. So personally, I was interested in agriculture and working with farmers and ranchers. So I sought out the National AgrAbility Project on my own to see how I could get involved. So that took some research on my end to see what efforts were being made, and then just working with the National AgrAbility Project to see what projects could be done. But other partnerships might include students working with a state AgrAbility project and or an agricultural service provider just to provide additional research efforts that might not be available right now. Maybe doing some presentations or workshops. You might also consider fieldwork or internship opportunities. So I've had the opportunity to do an internship with the National AgrAbility Project, so that might be something else to consider. I know there's various OT programs around the country that are requiring their students to do some type of field work within rural communities, so that might be an idea to get more students involved. You might also have students help make some farm visits or help give some ideas on what type of intervention techniques should be incorporated with clients or assistive technology. And then maybe just even getting students involved by educating farmers and ranchers, and maybe that's ergonomics or body mechanics or something that they have a little bit of expertise in but can apply to the agricultural population. This might also include developing some type of assessment tool, if that's a farm safety assessment tool or just any type of assessment that you might need. You might also look at educational opportunities in terms of presentations or trainings or workshops. So all things that either occupational therapists can do or AgrAbility can perform for health professionals. So I just wanted to give a little bit of topic overviews for those who might want to get more involved, but maybe not sure how to get involved. So in terms of maybe AgrAbility projects wanting to educate health professionals, some topics that you might discuss are farming and ranching with a disability, maybe safety on the farm in terms of machinery, how to prevent injuries or secondary conditions. So again, looking at body mechanics or ergonomics, and then maybe even looking at farm and rural community accessibility. So this might be a few topics that you present on in terms of educating healthcare professionals. You might also be interested in just creating a training program or a workshop, and I think this can go for both ways. So either an AgrAbility program can do a training workshop, or health professionals or students could incorporate some type of training workshop into the academic work as well. So I might want to look at different events that are happening, so community events, health fairs, maybe field days, any safety training seminars that might be taking place, and just looking at what might be available that you could get involved in. So in terms of maybe AgrAbility staff educating health professionals. You might create a training day or a workshop that looks at conducting an on-site farm assessment. Might look at how to determine what is appropriate assistive technology or equipment for this specific population. Maybe looking at some case studies. What are the characteristics of farming with a disability? Again, that idea of farming culture and the philosophy that's slightly different than working with other clients. You might also look at some hazards or risks that are involved with farming and how we can eliminate those. And then maybe even doing some on-farm demonstrations. And I believe the Nebraska AgrAbility Project just had a health professional training program similar to what I was discussing. I think they had that yesterday. So that might be something to consider as well. Just doing a one-day training workshop or a seminar that talks about health professionals and how they can get involved in agriculture. And then, so everything else kind of on the slide we've already covered, but we might also serve as just consultants. So I think occupational therapists would serve great with an AgrAbility project or an agricultural service provider to give additional ideas and our expertise on how we could impact the agriculture community or a specific client. And then we might also partner together to work on publications. So each entity has their own specific expertise and knowledge, and bringing that together could really impact our clients. So that right-hand column, again, just explains a little bit of what I've already highlighted in terms of how can we create some outreach efforts to health professionals or associated community members, how can we conduct some training and seminars or workshops, and then how can we really get our graduate students or our health professional students involved within agricultural work? So is that incorporating various topics such as safety or assistive technology into a class, so a normal general class, or do we do a training seminar? Do we have a webinar? Student OT associations. I've had a few reach out to me in terms of maybe having a presentation. So all sorts of ways that students can get involved. This is a very vulnerable time for students in terms of choosing a career path. So it might be a good idea to just reach out and provide some opportunities for students to get involved with agriculture or working with farmers or ranchers. A lot of research has shown that if there's no efforts made during the graduate curriculum work, then typically these individuals will not pursue this area of practice in the future. So really giving students an opportunity to discover what areas they might be interested in. So I wanted to give some publications that are available that kind of explain a little bit more about the role of occupational therapy within agriculture and some efforts that are being made by specific occupational therapists working with farmers and ranchers. So there's 3 specific ones there on the screen. A couple other ones that I did not include. There's a resource entitled Agriculture for Life, Health Promotion and Successful Farming and Ranching for Ag Families. And this is a great resource for anyone who might be working alongside farmers or ranchers and just how to go about the process in terms of if someone gets a disability, how can they kind of return back to farming, what are the steps that they should consider and the areas that they need to think about before returning to the farm. Another publication specifically for those who might be interested in incorporating agriculture into health profession curriculums might be the Agricultural Medicine and Rural Occupational and Environmental Health, Safety, and Prevention. This is a great textbook just explaining the role of occupational therapists, nurses, doctors, veterinarians, and how they can get involved with working with farmers and ranchers from a medical standpoint as well. I believe this book is used for the University of Iowa's occupational and health training program that they have. So I kind of wanted to wrap it all up then with this last slide. So for those that might be familiar with either picture, the picture on the left-hand side is the AgrAbility model, and then the picture on the right side is the Occupational Therapy's PEOP model. So something that I found very interesting when I first arrived at AgrAbility was the AgrAbility model. And as soon as I found that, I instantly thought of the model that I was taught in the classroom of this PEOP. And so something that I think is, when you look at both models, they're both looking at the individual holistically and how the individual is impacted in terms of their community, their family, their employment, and how this impacts their function or their performance on the farm or with their daily occupations. So while we might not have a lot of occupational therapists or health practitioners or therapists that are working directly with AgrAbility or with the agricultural population, I think it's important to note that our ideas and our philosophies are very similar in how we want to rehabilitate farmers or ranchers to get back onto the farm and continue their daily occupations. So with that, I will turn it over to Paul.
Danielle, that was an excellent presentation. We appreciate you connecting the dots for us there with the connections between AgrAbility and occupational therapists. And we're going to be welcoming questions from our participants in the audience. If you'd like to ask one, please either enter that into the chat window or go ahead and click the raise hand icon near your name. And while we are collecting those, at this point I'm going to turn things over to Sean Ehlers, who's our technical assistant on this webinar, and he will be putting up the questions that have been submitted. Again, you can continue to ask those questions as we go along during the question and answer period, or again, feel free to raise your hand and we will activate your phone or microphone.
All right. Let me read the question real quick. I would definitely advise OT students to take any type of agricultural class that they can. I know that there are a few programs that are actually incorporating agricultural principles or topics into the classroom. So the University of North Dakota, I believe, has a 30 credit hour module that they incorporate. I also tell students if there's any way that you can do like additional training programs, whether or not that's having a member of like AgrAbility or an agricultural person come in to either a class or even having a farmer or a rancher come into just a typical general coursework and talk about maybe what their occupation looks like in comparison to other occupations. That might be a good plan as well. In terms of, let's see. For those like without ag experience, my suggestion is always just to try to immerse yourself in it as much as you can. If you don't understand where a farmer or a rancher maybe is coming from in practice, ask them specific questions in terms of what they do. Maybe have them show you if you have any opportunities to go out to the farm and experience what a farmer is actually doing. I would try to do that as well, especially for those who maybe don't have a great idea in terms of agriculture. But there's a lot of literature out there that also explains what occupational therapists are doing with farmers and ranchers and how they can get involved. Hope that answered that question. In terms of how OTs could expand their traditional practice, I think a lot of this is if you have a farmer or a rancher in the clinic, it's how can you incorporate some of these farming principles, like I kind of mentioned. So bringing in things that are applicable to the farm. So can we bring in dirt? Can we have them, work with specific tools that they might be working with? How can we most closely simulate that? In terms of outreach efforts, I think that occupational therapists are great in being able to reach all populations. We have this holistic view of how to work with clients. So working again with an AgrAbility project in terms of outreach efforts. You could also, if you're in practice in a clinic, maybe doing an in-service that talks about how to work with farmers and ranchers or agricultural occupations and bringing that into the clinic as well. So in terms of assistive technology funding, I think it depends on what area of practice you're in. So are you an occupational therapist working with an AgrAbility project? Are you just doing consultative roles? Are you actually working in a clinic? So it all just kind of depends. So sometimes assistive technology is covered if it's big equipment. Maybe you need a lift for a farmer. We can work with vocational rehab to see if those funds will come through that way. Sometimes assistive technology is covered through your traditional Medicare, Medicaid services, insurance companies. And then assistive technology doesn't necessarily have to be anything that costs a lot. So assistive technology, like I said, can be something as simple as making a cup holder or making some type of stand for a laptop. And those are all things that you could use those resources in everyday practice to help, or that you kind of find every day, and just make those on your own to cut out some of these fundings or the required reimbursement that might be there. So I have not specifically worked with the Amish communities myself, but again, I think this goes back to what I had kind of mentioned previously in terms of assistive technology. You might have to approach assistive technology a little bit different for this population, but just being able to show them what you could do with everyday things that they have on the farm, that might be a way to kind of get them initially receptive to what you're suggesting in terms of assistive technology. But I honestly I haven't worked with this population, so I don't have a lot of expertise in terms of how best to apply assistive technology. All right.
Okay, thank you. Thank you very much, Danielle. Again, we appreciate your expertise here and also the participation of our audience today. I would just add on that last question, from our experience with AgrAbility and through our farm safety program at Purdue, we have worked with some of the Amish communities in Indiana and surrounding states. One thing that you should know is that each Amish settlement has its own unique rules in terms of the technologies that they use, and there may be similarities between settlements, but there also may be differences. So it's important to be able to network with the bishops in the Amish community where you live, to establish relationships with them and find out what they are open to. Some have shown resistance to things like electric wheelchairs before. Others don't have a problem with that. Same with augmentative communication. Some find speech boards to be outside the boundaries of what they've used in the past, or iPads. But again, it's a fairly individual call in terms of the specific settlement. So it's always good to establish those relationships, and that's how you're going to make inroads with those communities generally anyway. So that brings us to the end of our presentation for today. Again, we do have more webinars in the works in the coming months, and we will plan to alert you to those so that you can participate if you would like to. Thank you for your participation again, and we wish you a good day.